Today we're saddened by the death of Senator Ted Kennedy, who died of a malignant brain tumor, a malignant glioma, otherwise called a glioblastoma. And his death raises some questions in terms of how do people die with these tumors? What's their mechanism of death? How does this happen? First, a note of caution. Everybody's different, and all tumors are different, and all people respond to their tumor differently. So that when people quote statistics about a particular type of tumor, they are only statistics, and statistics never apply to the individual. So we really have to remember that when we talk about any patient with any type of tumor, but particularly people with glioblastomas. These are highly malignant tumors that tend to affect people in their 40s, 50s, 60s, and beyond. They have a bad reputation with a very poor prognosis. However, having said that, there are patients in every neurosurgeon's practice who have lived 5 years, 10 years, and even longer with the same diagnosis. Now, there may be different variations of this type of tumor from a genetic point of view, and that may account to some degree for the differences in survival. Also, tumors are located in different areas of the brain. In some areas, the tumor can be removed completely, even though we know that's not the case, but at least a great majority, a great portion of the tumor can be removed surgically without any deficit. Other tumors are located in very sensitive areas of the brain and can't even be biopsied, let alone removed. Those patients usually will have a worse prognosis, but not necessarily so. The age of the patient, the neurological condition of the patient, the way the patient presented in the first place, the type of treatment, the extent of surgical resection, the type of radiation, the type of chemotherapy, all play into the eventual outcome. So that if a person, Uncle Joe, has a malignant brain tumor, a glioblastoma, the chances are he won't do well. Over the long course, over the short course, he will. But even then, Uncle Joe has a chance of surviving. We shouldn't just write him off because he has a certain diagnosis. With appropriate treatment, with good internal resources, with the proper mental attitude, and with who knows what else, many, or at least some of these people can survive, and they can survive with a good quality of life for a long period of time. Having said that, what about the people who don't survive? How do they die? Well, there are a number of ways in which people die from a malignant glioma. One of which is the tumor continues to grow, and the swelling around the tumor continues to expand, so that the pressure within the head builds up, and eventually the pressure within the head overcomes the pressure of the blood trying to get to the brain. And when that happens, the brain suffers from what's called ischemia, or lack of oxygen, and eventually the patient will slip away and succumb, will die. Another way in which people die from malignant brain tumors is that the tumor may hemorrhage. There may be a hemorrhage within the tumor. So that causes a sudden increase in intracranial pressure and a quick death, as opposed to the more gradual death with a gradually growing tumor. Also, you have to remember that people with malignant brain tumors are subject to other life-threatening illnesses, such as deep venous thrombosis, or blood clots in the legs, which can then travel to the lungs and cause sudden death from a pulmonary embolism. This is a frequent cause of death in people with tumors of any type of tumor of the brain, but particularly malignant tumors of the brain. People can also die from seizures. This is rare, but people with brain tumors can have seizures, and occasionally the seizures can be so repetitive and the lack of oxygen to the brain can be so significant that the person actually dies of his brain tumor. And finally, some people with brain tumors become so demented either because of the tumor or the radiation for the tumor or the chemo for the tumor or a combination of all of the above that they succumb to the general illnesses of the infirm. Pneumonia, pressure sores of the skin, septicemia or blood poisoning are some of the few. Urinary tract infections would be another group. So that there are many ways, unfortunately, to die of a brain tumor, particularly a malignant brain tumor. Some are quick, some are slow, some are painful, some are painless. One size does not fit all, just as one prognosis does not fit all. And we have to remember that. And that's why we continue to treat these people aggressively, with hope and with a desire to make their life better in all ways, but at least in some ways. And never lose respect for the human being, never lose respect for the possibility that there will be a cure.